The wrong outpatient level of care costs your center twice. OP, IOP, PHP. Place a patient too low and they risk relapse. Place them too high and you face payer denials for services that exceed medical necessity. Matching patients to the right level is one of the most consequential decisions a treatment team makes. It drives clinical programming, insurance billing, and regulatory compliance. In this guide, what each outpatient level covers, how ASAM-aligned documentation supports it, and the billing considerations that keep programs financially sustainable. First, the licensing picture. Most states issue two broad license categories, inpatient and outpatient. Under an outpatient license, providers can deliver three distinct levels of care: standard outpatient, intensive outpatient, and partial hospitalization. Some states classify PHP under an inpatient license instead. Verify your state's Department of Health Services guidelines. Get placement wrong in either direction and there are real consequences. Place someone too low and they risk relapse without adequate support. Place them too high and you create unnecessary cost, reduce bed availability, and may face payer denials for services that exceed medical necessity. Each step-down transition should be guided by clinical assessment, not arbitrary timelines. This is where Behave Health fits, all-in-one software for behavioral health organizations managing outpatient programs. ASAM-aligned documentation workflows are designed to support level of care and utilization review decisions. And integrated billing workflows are designed to connect that clinical record to your revenue cycle across every level of care. Now, the three outpatient levels themselves, from lowest intensity to highest. Standard outpatient, intensive outpatient, and partial hospitalization. Level 1, standard outpatient, the lowest intensity on the care continuum. Typically 1 to 2 sessions per week, generally under 9 hours of structured programming, though state definitions vary. Clients live at home or in a sober living residence, with a stable environment and adequate social support. It serves patients stepping down from IOP and individuals with mild substance use disorders or co-occurring conditions. Level 2, intensive outpatient, for people who need more support than standard outpatient. 9 or more hours of programming per week, usually across 3 to 5 days. Sessions run 3 to 4 hours each. It's a primary modality for patients assessed at ASAM level 2.1 and a step down from PHP or residential care. State Medicaid programs and commercial payers may define IOP hour thresholds differently. Level 3, partial hospitalization, the most intensive form of outpatient treatment. 20 or more hours per week, typically 5 to 7 days, with daily sessions of 4 to 6 hours. Patients assessed at ASAM level 2.5 are typically placed in PHP, daily clinical contact and medical monitoring without overnight residence. And remember, some states license PHP as inpatient, which changes regulatory requirements, staffing ratios, and billing procedures. The ASAM criteria are published by the American Society of Addiction Medicine, and the 4th edition updated the terminology. Use current dimension terminology when documenting outpatient services, from intoxication, withdrawal, and addiction medications through person-centered considerations. The older 0.5 to 4 shorthand is still useful for search and payer conversation, but don't present it as the full current continuum. Payers may ask for initial assessment and continued stay records to support the billed level of care. Requirements vary by payer, contract, and jurisdiction. Each level bills differently. These codes are commonly used but not exhaustive. Verify current coding guidance with your billing team or payer. Standard outpatient typically bills per session. Individual psychotherapy codes 90837 and 90834. Group psychotherapy 90853 and H0004 per 15 minutes. IOP may be session-based or per diem. H0015 or S9480, often used by commercial payers. PHP is most commonly per diem, H0035 or S0201 with some commercial payers. 4 billing considerations protect your revenue. Most payers require prior authorization for IOP and PHP. Standard outpatient may not, but policies vary. IOP and PHP often require concurrent or continued stay reviews, document current clinical facts, and what's changed since the last review. PHP per diem rates generally bundle all services that day. Billing individual therapy codes on top may trigger denials. State Medicaid programs define covered services, codes, and rate structures differently. Verify before submission. Accurate billing starts with accurate clinical documentation at intake and at every review point. C. ASAM-aligned documentation workflows and integrated billing in one platform. Book a demo at behavehealth.com.